guys. Welcome back to the Comeback Era. Today we have Dr. Hilary Fritsch on. She is knows all things airway. She is a biological dentist. And I just have so many questions for her. I think I'm just extremely passionate about anything alternative. I just have so many questions. I'm so curious about how you can kind of intervene in a non-surgical way. And yeah, I have 1,000 questions. So Hillary, thank you for being here. We can't wait to open the floor up for you.
Thanks for having me, guys. I look forward to answering all your questions.
Good.
Hopefully.
I love this because I've been through a lot of health issues myself that kind of was a huge catalyst for me, like seeking alternative routes for medicine. And I feel like that kind of has a lot to do with your story and kind of what kind of snowballed this whole situation was your autoimmune journey, your healing journey, and all that. So I'd love to dive into what started this, what started Tooth Pillow, and how we got to this place where like seeking alternative medicine solutions and things like that and kind of working with our body to heal itself kind of.
Yeah, so my journey has been basically I was diagnosed with an autoimmune disease that it's a spinal arthritis called ankylosing spondylitis. And I was diagnosed right before I started dental school and um, basically was like in a very dental school type mindset where it's like, this is genetic. There's nothing you can do about it. So I was doing everything wrong, eating really badly in the cafeteria food and
Yeah.
probably drinking too much
We've all
beer
been
with
there.
my friends. Yeah, and not getting enough exercise, living in the city, just a totally different lifestyle than I have now. And basically, when I decided that I wanted to get pregnant, I had to kind of get off of the medications that I was taking that was managing my inflammation. And so I needed to figure out ways to manage this more holistically and went on a journey because in my heart, I always knew there's a root cause here that I'm not addressing. And so I started to look for that and I needed to basically like look at all the things that were going wrong. And one of the big things was my mouth breathing and my terrible sleep, which I didn't know how to fix at that time, but it had been a problem my whole life. And I was like many girls, was really good at compensating. And so everybody thought I was fine, but I
That's
knew
always how it is. Everyone thinks you're fine. And you're like, I'm fine. Everything's fine. I'm just a little tired. Or it's always like, I'm fine. But really, we know there's something deeper going on.
Well,
Yeah,
and
I
it's
mean,
just no one ever talks about anything. I feel like there's going to be such a awakening to mouth breathing. Obviously, we're in the fad of wearing mouth tape and stuff like that. But now I think people are realizing, oh wait, this is something that I can figure out and come to a conclusion very early on in age. Especially like that's how we got connected is through Tooth Pillow because both my son and my daughter are mouth breathers and they have cross bites and underbites. And I'm just like, I'm kind of in this limbo of what to do if I just go into a full expander route. And that's where I found Tooth Pillow.
yeah, I mean, if we had 100 years ago, dentists knew about this, but it's become a lost art and we need to get back to it. Like I think every kid should get evaluated at age 3. There's so much that we can do when we start young to help correct it, but there was no way I was going to be able to breathe through my nose. Like I was just one of those kids that needed intervention.
Yeah.
I couldn't have just like taped my mouth shut and solved the problem. Like my nose
Same.
just wasn't working.
Yeah.
Yeah. I think it might have been a combination of mold and some, obviously the jaw and development, they kind of like go hand in hand. When you don't have the tongue on the roof of your mouth, your jaw doesn't grow properly. And so then it's like the problems compound on each other
Mm-hmm.
because the roof of the mouth is the floor of the nose. So if we don't grow the roof of the mouth, then the nose isn't developed enough. So then we can't breathe through our nose and then we mouth breathe more. And then it's just like,
It's a vicious cycle.
yeah, we're not going to solve it without intervening. So anyway, I figured out how to like heal myself and did a lot of different things, like healed my gut, worked on my sleep quality, changed the way I was living. But that didn't really translate into my dentistry until I was like brave enough to shed the old system and say, I guess I don't care what people talk about me anymore. I don't mind being the quack in town and I'm going to do
Totally.
this that I would like
We
to.
all hit that point at some point.
Yeah.
When you have the chronic illness, eventually it gets to this point where you're like, You know what? And it's funny because you were mentioning like, oh, we knew about this 100 years ago. And I feel like everything points back to how things used to be and how we were doing things before. And for some reason, we've lost the old fashioned ways. And then we're going like looking to all the wrong things when the root is usually a pretty simple answer, I feel like.
Yeah, I mean, the funny thing is it was money that I think drove this whole problem to begin with, because it was when baby formula was introduced that the problem started getting really bad. And obviously, baby formula saves a lot of babies and it's totally necessary.
Totally.
But along with baby formula came Gerber and smoothie pureed everything.
Mhm.
And that has led to big jaw development issues. And along with that corporate influx, doctors started saying, you have to give them everything pureed because we don't want them to choke. And it was like all pushed by this corporate agenda, which now we need to dial it back and go back to like,
Mhm.
give your baby a piece of steak to gnaw on, let them chew on the chicken bone, like give them the mango pit. They need to develop the muscles in order to develop the jaws, in order to develop the airway, in order to develop their face. Like it's all goes hand in hand. So if all you're
It's such an intricate, like, process that, like, what it's like such a little domino effect that you're like, you don't think that chewing on a piece of steak makes such a difference, but it's the pacifier size, it's all of the things, it's the bottles versus the breast, and it's like this little thing that you don't think is such a big deal, like, you're like, "Oh, I'm breathe through my mouth, that's I have 2 options of breathing, and one of them, like, why wouldn't one be fine?" You know what I mean? And I don't think we think about this enough in the way that it really does affect everything.
Mhm. Obviously, our oxygen, it's to our brain and everything. Um, yeah, it's I think about when my youngest was or my oldest was young, I used to give him the core of the pineapple and just let him, like, suck on it
oh,
and bite
good
it.
job.
But anyways, I mean, he still ended up with, again, like I said, cross bites and underbites. So it's something that I'm definitely this is why we're here. I want to figure out how do we fix these types of things and what are, if parents are struggling with like all the things that come with, I guess I'll let you speak on the things that you see most common where parents could say, "Oh, maybe this is an airway issue," whether that's a behavioral problem or what are the things that parents have to look out for?
I mean, one of the big things is hyperactivity, ADHD type behavior. That's like that jet lagged kind of like they can't chill out and sit still.
Mhm.
We also see like dark circles under the eyes, bedwetting, teeth, baby teeth with no room for incoming permanent teeth. There should be 2 to 3 millimeters of spacing in between all the baby teeth. So if you don't see gaps everywhere, that's a red flag. That means the jaw development is underdeveloped.
Wow.
Teeth grinding, restless sleep, like when their hair is a big knot in the morning. All of
My daughter.
those things are an indication that they're not getting quality sleep, like they're rolling around too much. And when you start to see it change, then you're like, oh, this is normal sleep. Like they should be silently breathing through their nose and laying still, not
Right.
rolling around and kicking. So that's one big thing. I would also say, like picky eating is actually weirdly one of the things that we can make a big change on when we start to get better sleep, because you just want quick carbs when you're hungry,
Right.
and
That
overtired. I
makes so
mean,
much sense. You're just dying for some energy, so you just grab the quick carbs, and that makes so much sense.
So much sense.
And
yeah, that's one of
it's
the
all
big
these things we've
factors.
written off. We're like, "Oh, that's just they're just a picky eater," and all these things, and it's all these little intricate going back to, like, the first domino where you're like, "Oh, it might just be the mouth breathing," and, like, seeing how that adjustment, like, affects everything.
Mhm. Totally. Night terrors, gosh, so many different things associated with improper sleep end up impacting their daily lives, like chronic
Mhm.
headaches, chronic stomach aches. Um, I was actually that kid. I always would get a headache up here, and this is typically that forehead headache is from poor sleep. But if you get headaches in here or here, this can be from clenching and grinding. Neck pain can be from like having kids who have a poor airway, or adults too will push their head forward to keep their airway open, because if they were to straighten up, it kind of pinches off.
That's what I do. Oh, it's so annoying. Yes. All the time.
TMJ problems, because we're compensating by a collapsed airway. If you tighten all your muscles, it's a way to open the airway again. So that chronic especially shows up in females more. So there's like basically anything
Plethora of
that seems out of
things.
whack, you need to look at the sleep almost.
Yeah.
Right. Mhm.
But it's wild to see like the difference between a mouth, like the bone structure and jaw structure of someone who is a mouth breather versus someone who's a nose breather, and just seeing like how it like actually adjusts the structure of your face. And it's one for aesthetic purposes alone, but two, like we're saying, you know, ADHD, headaches, migraines, all of the list of all the health issues that go along with it, and the way that that's affecting our sleep and everything overall, it's actually insane. And it goes back to, again, this one little domino. So when you were figuring all this out, like like got you to the point where you're like, it's mouth breathing? Like when you had this like aha moment where you're like, hold on, wait a minute, it's mouth breathing.
Well, it was basically when I started studying with Kevin Goles, who was one of the Tooth Pillow founders, that I really like put it together,
Mhm.
because nobody was really able to explain that story. Like we weren't taught anything about it in dental school. And
Totally.
there were a few cowboys out there like Dr. Ben Morelli and Kevin Goles and Callie Hitt, like some of the founders of Tooth Pillow, that were like willing to experiment with this and figure it out and kind of go back to basics on jaw development and proper sleep, that were starting to put the pieces together. And so that was one of the reasons that I love Tooth Pillows, because until I found that community of doctors, there was nobody that really knew what was going on, and they didn't know what the finish line was. They didn't know how to get there. They didn't understand how to help patients. We knew that there was some interconnection, but couldn't find anybody that really had it figured out.
Right. My mom's a dental hygienist, and so I was telling her when I discovered tooth pull, I was telling her about it, and she's like, "What?" Like she just did. You know how you guys have your regular. You have to stay up with your courses, and every so often, a few years, and so she finally, funny enough, had an airway course this year, and I was like, "Oh my gosh!" My mom's been a hygienist since I was a baby. And I'm 34, so it's like it's come that way all of a sudden. Now they're talking about this stuff, and it's so way too far
Yeah.
gone. But
Yeah,
for
we
our
missed the mark
listeners,
badly.
huh?
We've missed the mark and made airways and faces worse, like, for a long time
Yes.
now. It's actually really disturbing. I see
Do you
patients
think it
every
has a
day that I'm like,
correlation with like the mental health nowadays?
"Oh, yeah, I mean, if you don't have good sleep, you're way more likely to have depression and anxiety."
Mhm.
You know how that is, even after one bad night, you're like,
That's
"Ugh."
true. Yes, like postpartum when you're just like dying of sleep, you feel like you're crazy. I'm like, "Okay, don't make a decision." I always tell myself like don't make a big decision on little sleep because it's just, you got to be able to control that for
We've
sure.
we've all been there.
I
So,
know.
question for you. So, like, how did you find the courage to like ignore the experts and to be like, I need to heal myself? Because, like, the mainstream way is one way, and what we've all been taught, and
Like the ADA says this is a
right.
fact. This is
So, like,
this.
how did you find that courage to go against the grain and say, this isn't working? I want to try something else.
Well, I had to figure out how to help myself and my kids. And then I had patients that were coming to me too and being like, "Can you make me that thing Joe Rogan wears? Like that thing he's wearing at night for his sleep." And everybody was starting to like need it and ask for it. And it just felt like we have to push through this fear of expansion. And it just became obvious that if I didn't take a chance, that I wasn't going to fix myself or my kids.
For
So,
sure.
and then I also found people who I felt like I could trust. They were like, "I've done
Mhm.
thousands of these. This is what it looks like. This is a sleep study afterward. This is what their face looked like. This is what the CT scan looks like." And you're like, "Okay." It didn't take
You're like, the
very
results
many
don't
of those.
lie.
Yeah, I was like, "I'm in. Let's go."
Is
You
that
know.
something that you look at like if obviously you're treating a range of people and someone comes in, is that like the first thing that you go to? Is it like a scan, an ultrasound?
We do a
Just
CT scan, which is like a 3D image of the head and neck. So I can see the airway in 3 dimensions, and I can look at the sinuses and the nose and how much room they have between their molars, how much tongue space they have. I can see tonsils and adenoids. It's like really helpful tool. And
wow.
it's also helpful to show the patient, be like, "Look at your airway is the size of a coffee straw." you know?
Yeah. I'm sure
Wow.
that's so validating for some people who have been like having chronic illness and just don't they feel off, but have been like kind of gaslit into being told that they're fine. And I feel like the more I feel like we're talking to people, the more we're finding people who just feel like all of their symptoms have just been like absolutely neglected and just like completely like, oh, you're fine. Like everything's fine. The labs are all normal. Everything's fine. And like actually like taking the time to do the CT scan to show them like, hey, your airway is this big and it's not supposed to be that way. I'm sure
Yeah.
like that is the first step for a lot of people feeling really validated for like, okay, I knew I wasn't crazy. Something felt off.
Yeah, patients sometimes start to cry, sometimes they get
Oh, I
angry, and
believe it.
they're like, "That's what it feels like. I feel like I'm choking on my food. I feel like I can
Mhm.
feel my uvula, like, in the wrong spot, like, I can." And they can sometimes get angry because sometimes a previous dentist pulled some teeth and pulled their jaw back,
Mm.
or sometimes they've, like, been to every single doctor to try and figure out why their 17-year-old still bedwetting and nobody gave them a solution,
Wow.
and then sometimes they're like, I'm so tired all the time, and my airway's this big when I'm wide awake and upright. No wonder I'm
Mhm.
feeling like this." So it's a lot of emotions, and then we do a sleep study to confirm what
Okay.
like I want to see sleep fragmentation or apnea or various different things so I can kind of decide how
Do you
severe
think
is
that
this.
that's reversible?
Oh yeah.
Really? Because
Oh
obviously, if someone has sleep apnea, it's kind of like the final, diagnosis. And I know my mom has had that discussion about like your palate stops growing at a certain age. So it's like, are these things that are actually even reversible?
oh yeah. I mean, this is where it gets like the quack dentistry comes into place because we were told that you can't change the palate
Right.
after teenage, like, I don't know, they used to say like 12. That's not
It
really
was like
true.
the age of 9 or something like that, I thought.
Yeah, we can put a fixed expander in a 16-year-old, and I wouldn't do that because they don't like it. I quit doing it at age 14, but you can the sutures are not fully closed. You can move the suture with a fixed expander.
And is
After
that a
that,
device that you implant in that like stays in 24/7, or is it something like a tooth pillow that's in and out?
there's choices. So we
Okay.
can in 16 and up, I started at 14, so let's just say 14. 14 and up, we can use a removable expander like the Vivos one that I use, which doesn't open the palatal suture, it just remodels all the bone by like
Wow.
pushing on the bone. So when we push on the bone, we can remodel it. So we can move the molars out and push the front teeth forward and like blossom the whole thing.
I
We
wanna do
can
that
use a
so bad.
Marpy, which is an expander that is screwed into the palate with implants, and that will open the suture. Like there's a day when you're turning it and it pops open.
Wow.
Or you can do surgery where you break the jaws and move everything forward. And
Right.
you can also not remodel the palate, so you won't change the nose, but you can move them. If they can breathe through their nose well and mouth tape all night, then that's a patient that sometimes all you need is clear aligners to like you can make the
Expand
smile
it.
really wide just doing that.
So are you saying clear aligners as in like Invisalign
Yeah.
or is there a separate one that you're thinking?
I don't like Invisalign. I don't think it's as powerful and it doesn't have an airway specific protocol. The plastic
My
isn't.
mom always says, like, she hates those because it doesn't do anything for the jaw, it's just moving the teeth, which then is actually messing with your bite and all this stuff, so it causes more issues in the long run, so, you know
I just finished Invisalign. Shit.
but her, like, her jaw is, I feel like, great, and, like, mine is very, narrow this way, and it's like, I've always felt like it needs to go out more.
Yeah, you could totally accomplish that with clear aligners, but
Yeah.
and you can do it with Invisalign if you know what you're doing, but they won't typically give you an expansion protocol. So I work with a
Something maybe you
company.
asked for?
You could. I just they have techs that design the case, and I don't know. I feel like you'd have to go in yourself and use their tools to modify and
Hmm.
do what you want with it. But I just don't know why you would pay for Invisalign when there's other companies that are like,
So what other companies would you recommend instead of Invisalign?
I like a company called Smile Shapers. I think they're also going by the name Airtho. They're kind of in their infancy right now, but they are doing a really nice job. They have this Enduroplastic, and the plastic comes up higher up of the gum line, so it can really grab into the undercuts of teeth and move them
Oh,
more
wow.
powerfully. And it's designed by an airway trained orthodontist that has
Amazing.
been taught by Kevin Goles. So it's got like his brain behind the 6,000 cases that he's done. And then there's a company called Candid that I've been working with for the past 2 years. That's also got an airway specific protocol that has that same zingeroplastic, and it's just they're both a really nice airway aligner protocol.
Amazing. So take us into, if you can explain now, going back to like tooth pill, obviously with kids that are mouth breathers and somebody wants to start there, how would you explain tooth pillow's device, how it works, how long it takes, the consultation process, kind of all that.
And the right age to start it as well.
Yeah.
Okay. So Tooth Pillow was born from a need to have more airway dentists, basically. Like there's so few of us that know what we're doing and can help kids. And almost every kid needs intervention. That's why every kid needs orthodontics and every kid needs their wisdom teeth out. So if you
So this is kind of like a preventative, so kids don't have to get braces, right?
Yeah. So Tooth Pillow decided we got to get airway dentistry available to more people. And they basically use a guide or an appliance. It's a piece of plastic that seems really simple, but what it does is it pushes the lower jaw into the right position, forces you to breathe through your nose. It gets the tongue and the lips stronger in order to keep it in. And when we have strong lips and strong tongue, then we have good breathing posture. And when the tongue is on the roof of the mouth, it pushes forward and wide and helps us grow. So it's kind of like a 4-for-1. It does all of those things. And if they wear it at night and an hour or two during the day, we can get the body to like do what it was meant to do naturally with that appliance. So there's different appliances for different size mouth and different bites. And we basically choose one, mail it to them, and we have them do myofunctional therapy, which is like PT for the tongue and the lips to get the posture really good and everything really strong. And between those two things, we can get this kid now growing all day and all night instead of just maybe 5 minutes here and there when they get their tongue on the roof of the mouth.
How long does the kid have to wear it? Obviously, we know you mentioned at night and for an hour, but is this something like, do they get a permanent retainer after or something along those lines? Like, does the jaw go back?
It could if they don't get their tongue posture figured out. So the tongue is like God's retainer or God's orthodontics. It's meant to like push on the roof of the mouth and help us grow. And if we don't have it up there, then we're going to collapse over time.
It's so funny. I was just thinking about how this whole time, whenever I'm just like, actively listening to
my tongue on my roof of my mouth.
That thing where you like, I've seen it on TikTok where you go like suck and like and I'm just keep being like, keep it up. Cause it's like, it's such a good little reminder because sometimes I catch myself mouth breathing. And even though I'm not a huge mouth breather, like there's still moments where you're like, oh, pull it together.
Or I'll stop myself and be like, breathe through my nose.
I was watching your face and I was like, she's doing a good job because you can tell like it tightens up under here when you get the tongue up and you looked really pretty, like your cheekbones.
I know it's funny, like for aesthetic purposes, it's like we all need to be just like doing it. And like whenever you take a photo, I feel like I help get rid of that dot. Clean it up, pull it all together.
Activate this. Basically, like if you push your tongue on the roof of your mouth and then swallow a couple times and kind of it like
vacuum seals your whole mouth.
Yes.
Interesting. Exactly. I'm going to keep practicing that.
I know it's a good little activity to practice because when you get in the because I'll catch myself just like sometimes just sitting there mouth breathing like a loser and I'm like, oh, like pull it together. But so it's funny because we're talking a lot about kids, but are you able to talk a little bit or do you want to just give a little teaser for what's the future for Tooth Pillow? Maybe expanding?
Yeah. Maybe
not only the pallets.
I basically Tooth Pillow, like every kid needs to get looked at age 3. So I didn't say that, and I kind of want to make sure because people need to know, like if we don't, the longer we wait, the more development is done. So the typical scenario now is we'll wait till they're 12 and all their permanent teeth in. 95% of facial development is done by then. It's way too late. Wow. So we want to be looking at everyone at age 3.
We want to get them in at age 3. And so not only is it great for development, airway and facial structure, but also isn't it it's to help prevent needing braces and crazy orthodontics. And you mentioned wisdom teeth also.
Yeah, there's a really good possibility that if we intervene at a young age, we will not have to do anything besides Tooth Pillow.
As tempting as it is to have that moment where you have your wisdom teeth taken out for the funny content that will inevitably transpire from that moment where you're all looped up on the
on it,
drugs,
yeah.
but I think everyone would like to avoid that if they can,
Yeah,
you
and then
know?
there's downsides to that surgery, like, you can have nerve damage, you can also get an infection that never really heals, people have that, like, chipmunk face for 2 weeks. It's a surgery, it's
Mhm.
a legit surgery, so
I have one wisdom tooth, but it's like in my gums still, and it's like sideways. I don't know if
It's
that's
impacted.
if it's just gonna stay there or what the plan is, but I otherwise the other ones never really came in. There's like you can kind of see like where they should be, want to be, and then there's only one that's like under the surface. Hmm.
yeah,
No.
there's been adaptations, and many people do not grow wisdom teeth now, or they only have 1 or 2
Yeah.
or something.
It's crazy,
Um,
like, evolution has changed where, you know,
yes.
I had all 4 taken out
Just wait, the pinky toes, the
with local
evolution is gonna get rid
anesthesia.
of that one too.
Yeah, that too.
Oh my god, funny.
Um, you said intervene for someone to have, obviously getting them looked at 3, they're not going to a regular, pediodontist,
Is that what they're
Yeah, you
called?
you won't get
pediatric dentistry.
you probably won't get airway evaluated with a regular dentist.
So they can
Some
reach out to a company like Tooth Pillow and say, "Hey, I would like my 3-year-old evaluated." And how do you guys go about doing that? It's all virtual, right?
Yeah, you submit a questionnaire and photos, and it's very easy to evaluate through the photos.
That's
Um,
awesome.
yeah,
Good luck
so
trying to get the 3-year-old down for the photos,
I
but
know,
I believe in
literally.
you. I believe in you.
it's
But it's awesome
surprising
too.
how
It's
well
like that's
people
where
do. Sometimes the
yeah.
bite is funny where the kid kind of postures forward, but we can, we're used to looking at them. We can kind of tell, okay, if they were to bite down, where would that be? And then once in a while, I'll push back and be like, you got to send me a better picture.
Right.
And that's fine too.
Where are you located? I see you in like a cabin.
I'm in
Montana.
Bozeman, Montana.
I
Oh,
love Montana. It's one
amazing.
of my
I've never
favorite
been,
places.
but
Oh, it's
I
amazing.
I watched Yellowstone, so
It's
There's
pretty
a
much
new
the
one,
same.
the Madison one out with
Oh,
Michelle
I'm
Pfeiffer.
dying to watch that.
Oh
didn't see
man,
that.
she's got a good airway. Her cheekbones are like,
Oh, Michelle Pfeiffer.
yeah,
Oh, yeah.
Stunning. Yeah, the
yeah.
whole cast is
That could be a
absolutely
little
beautiful.
filler though too.
I
No,
mean,
she
maybe,
had
but
yes,
she
but she
really
has
has a good
great
face,
bone
I think.
structure.
Yeah.
Yeah.
Yeah,
See,
she
I've had filler in my jaw to make it because I kind of have a rounded jaw. And so
Uh-huh.
I've put filler down here to kind of shape it out because I want more structure. But I honestly do think, yes, I have kind of a deviated septum. I'm a mouth breather. I always have been. So as an adult, you would think, like, I thought kind of like it's a lost cause for me. There's no way to change it now, you know?
No, you should do what I did with Vivos, where we make you a removable expander. It looks like an old fashioned retainer with acrylic on the roof of the mouth, and there's a little key in it that you turn, and it
Mm.
pushes wider and forward. And as you widen through the palate, this whole mid face develops. So
Oh my
I have
gosh.
like a total mouth breather face with that high angle in the mandible, and like I'm long and narrow. Because when the tongue is not on the roof of the mouth, your face literally grows this way instead of that way.
Yeah, and I have a longer face, and so I always try to fix that, but it's just amazing
Well,
that you can
you look
aesthetically
great, but like
thanks.
you could change it the bony structure. It's not too late. I take care of 70-year-olds even.
So that brings me back to my last question. So the future for Tooth Pillow.
Yeah, okay. For adults?
Yeah. I didn't know how much we were wanting to talk about it, but I think that, obviously a lot of people have children, and then there's some people like me, I don't have kids. So as great as it sounds, and my future kids, it's nice to be aware of these things. So when I have kids, I can take these proactive measures to make sure that they're, developing in the way that is the best and healthiest for them overall. But for some of us, we're like, wait, my mom didn't know about this. This wasn't a thing when I was a kid. And so a lot of adults are still looking for something to make us feel better, change the structure aesthetically for health reasons, all of it. So
Yeah, I mean, if you're having TMJ pain, headaches, you feel like your sleep isn't great, you can absolutely do what Tooth Pillow is going to be doing for adults is clear aligner therapy with an airway specific protocol. They're going to be using that Airthos Smile Shapers company that I mentioned, and making more room for the tongue. So
Mhm.
if you don't have enough room for your tongue, you got to picture your mouth as the garage for your tongue. If your garage is kind of small, your tongue has nowhere to go but back into the airway. It's like the tube that goes from your nose behind your soft palate, behind your tongue, and down into your lungs. And that tube is supposed to be the size of a garden hose. But if your
Wow.
tongue is like cramped in the mouth, then it's going to close off that garden hose. And that is what causes the sleep fragmentation. And so you don't have to be snoring even. Like I know plenty of skinny young women who don't snore, who have apnea because they didn't structurally grow forward enough or they didn't grow wide enough. And so they don't have enough room for their tongue. So their airways like having micro collapses. And sometimes it's not a full apnea. It's just like the basically taking your thumb on the end of the garden hose and like
Oh
Yeah,
my gosh.
totally.
Yeah.
increasing the airflow. And that causes fragmentation of their sleep because it's like micro arousals where they're trying not to die in their sleep.
Mhm.
And those micro arousals cause fragmentation and they're clenching and grinding. And now it's like head and neck tension. And a lot of times the upper jaw didn't grow enough. So the lower jaw has nowhere to go but back. And it creates all this tension in the joint as well.
Mhm.
So it's like this
So
cycle of problems that we can fix with just clear aligners on an airway
amazing.
specific protocol. So like if you want to do Invisalign, if you're thinking you want your smile to look better, but you want an airway specific protocol, even somebody like that would benefit from seeing tooth pillow.
Yeah.
So when can we expect? Do you have a rough idea for when the adult tooth pillow will be
Launched.
launched?
I'm thinking it's going to be in the fall. We really
Okay,
want
that's
to
soon.
we really want the whole system nailed so that people get fantastic results. And we need to
Mhm.
onboard enough orthodontists that really know how to design these cases so that when they
Right.
get submitted to the company, they come out really nice. So we're super close. I know Kevin Goals is working really hard on getting everybody up to speed, but we have to have enough that when like the influx happens that the system can manage it. So
But we are happy to be your guinea pigs if you need us to. I know I have like 3 Invisalign trays left and I have too much space in between my teeth. They are just like my teeth are all estranged when they want to be. And so I just a couple years ago was like, I'm gonna do Invisalign for myself and I just wear them at night just to make my life a little bit easier. But I also would love to see, even though my teeth are straight, like what the benefits of adding in that airway help. So if you need us to be guinea pigs, we're happy to participate if you need us as a case study. So
For sure.
um,
Come to Montana.
I would actually, yes, we will
well, you
have
don't
to
have to
come in
come to
person.
Montana.
True. We don't. It's
I'd
all
love to have
virtual.
you. You will
Luckily.
go
Don't say that.
see-
I want to come to Montana.
Yeah.
Well, for the adult cases, you'll go see a tooth pillow provider in your state.
Oh,
Because
yeah,
they
true.
need to scan your teeth and take photos. It's not like the kids ones where we can pick a device off the shelf.
I think there's
So-
one in Sarasota here.
Good to
Yeah.
know. And then but you were saying how kids are like starting the tooth pillow journey experience around age 3. So I know that there's a lot between 0 to 3 that parents can be doing to help set their kids up for success. So that way it's not such
An
a
intervention.
steep climb
Yeah.
and an intervention starting at 3. So what are some mistakes I think that parents are making from 0 to 3 that we could hopefully like kind of curve
Nip that in the bud.
Exactly.
Yeah. Well, one thing that you can do with babies is just encourage them to close their mouth. And then you can check when they're taking a nap, like peel open and see, do they have their
Mhm.
tongue up there? If they don't, put a little pressure and try and get them to close their mouth. Like they say French mothers are close their children's lips because they're more attuned to the fact that mouth breathing isn't good. So there's
Yeah.
just that piece. And then encouraging them to keep their mouth closed when they're chewing and stand up straight and, breathe through your nose. Those are like little cues that do help. I would also say a nasal hygiene protocol is really important. Like I like that X Clear spray
Oh, yeah.
where you blow the nose, spray it in, sniff it in. If you tasted it, you wasted it. So don't sniff it too hard. Let it break up mucus as long as you can, then blow the nose again. Because the more we keep the nose open, the better
You're
we
clearing
do.
it. Mhm.
Yeah. And then you want to check your house for mold and stuff because mold can be a big reason that the nose gets clogged up, which is like a whole different rabbit hole. But
Mhm.
I definitely chewing hard foods, eating real foods. Like we like a Weston Price diet. He was this dentist back 100 years ago who studied like why do supermodels all come from third world countries, and they have beautiful faces because they have beautiful airways, because they have beautiful jaw development, because they were eating organ meats and real food and breastfed for 3 years and not like eating those puffs and like little yogurt packs.
Yeah.
And
Yeah.
just everything
So
puree.
fascinating.
And it just feels, not to put my tinfoil hat on, but it feels like such a conspiracy that they're pushing all of these puffs and the pureed food and all of these things. Then orthodontics are like a huge
Moneymaker.
moneymaker and all of that. And then the chronic illness is another moneymaker. And then the ADHD meds are another moneymaker. So it's you can't help but go, something feels a little bit wrong here. And like, so I was diagnosed with premature ovarian failure at 29 years old. And so that was what started for me my whole health journey and experience, noticing like what was wrong with that. Everyone said it was um, unexplained infertility. And like, so it kind of goes back to everything you're saying, where you're feeling like gaslit by your doctors, like, oh, it's just unexplained. And there is a root and there is a reason. And it comes back to they hadn't diagnosed it yet, but I have Hashimoto's hypothyroidism. And so, like, all of my hormones were off, which is what was leading to the premature ovarian failure or insufficiency or whatever you want to call it. But it's just funny how people were so quick to label it. I saw 5 different specialists in Boston, which you know is known for their hospitals.
Mm-hmm.
And everyone was like, oh, it's unexplained infertility. And it wasn't until I found my doctor out in San Francisco who like actually explained to me what was wrong. Love her, egg whisperer, for anybody listening who needs a fertility doctor. She's the love of my life. She's like the reason I'll be able to have kids. And we froze my eggs and did all of that because I was running out of time fast and nobody wanted to help me. They're like, it's too late for you. And she was the first person who noticed, based on like one tiny little detail on my labs, that I had Hashimoto's. And she's looking at some other doctor's labs. Some other doctor took these labs and she's just reading old labs I had and was like, why has no one talked to you about this yet? And I was like, I don't know. Why haven't they? And it's just crazy how, you know, having one person think outside the box a little bit can really change your life. And for me, like, I wouldn't have been a mother if I hadn't found somebody who was willing to think outside the box. And it kind of just like makes me think a lot about like your health journey and experience and how many people are struggling with all of this like laundry list of issues. And it's something as simple as breathing through your mouth.
Mm-hmm.
You know what I mean? It's just wild how we're so quick to dismiss something simple and think we have to throw all these meds and throw Adderall at everything or what, and all of the things, when it's just like, hey, have you ever tried just breathing through your mouth? Maybe
Breathing through your nose.
that's what I meant. Breathing through your mouth, through your nose.
Stop breathing through.
Stop breathing through your mouth. Don't
Yeah.
breathe through your nose. You know what I mean? Yeah.
I have an interesting similar story. So my husband's an anesthesiologist. He trained at Harvard. We lived in Boston for 4
Amazing.
years. When I was pregnant with my oldest, I was going to doctors at Harvard and he would like find me the best ones.
It's Harvard.
Yeah. And I remember I was pregnant with Millie and my arthritis flared up so bad I could barely move. And I like literally I would take a ski pole with me to work. And I crawled into this rheumatologist's office, like just bawling because I was in so much pain. And I was like, I was like scared too, because I was pregnant. And I was like, what are we going to do? Like, I can't function. I need to work, you know, and he was in residency. So we were barely making any money. I really needed to be in the dental chair. And they put me on 60 milligrams of prednisone a day.
Oh, wow.
You know, I mean, I have so many regrets about things that I did. Like, you know, I wish I had.
You didn't know. You trusted the doctors. You didn't mean it's Harvard. So.
And and arthritis, my grandma was diagnosed at 30 or 32 with rheumatoid arthritis. So they put her on prednisone too, that young. So she's been on it since she's now, you know, in her 70s. And so it's like, it's just the thing that they do.
Yeah. I mean, he was like, you can't take Humira because you're pregnant. So you have no choice. And I remember being like, why? Is there something I'm eating?
Right.
Is there and everybody was like, no, it's genetic.
Yeah.
It's genetic. There's nothing you can do. And my dad was saying, you should get some exercise and maybe like eat a little healthier and go outside and get some sunshine. My dad was like onto all the right stuff. And I was like, Dad, it's genetic. And he's like, well, how come nobody else has it? You know, and I remember being like, I don't know why. Something's wrong with me. And I knew though in my heart that there was something else, but I couldn't figure out what it was. And I had no guidance. And I also just was working my ass off trying to get through school and like had no money and no means to like figure it out. Now I feel like I could, in the end, I sort of figured it out on my own and didn't spend any money on it anyway, but it took a long time, you know?
Yeah.
But it's funny how I feel like the more people I talk to who are having successful results, I feel like the majority of everybody is getting back to basics. And it's something like your dad's saying, eating a little bit healthier, getting outside, moving your body. It's like, doesn't need to be this like crazy, like P90X workout. It's like, get outside and just move. And also, have you tried some sunshine, and have you tried breathing through your nose? Like a lot of that stuff, like getting back to the basics, I feel like
Totally.
is the answer. And obviously there's not like, it's not like a one size fits all. And I think that there's a time and a place for everything. But more often than not, I keep finding that it's much more simple than we've been led to believe.
Yeah, and those are the hard things though. People want to just take a shot and not have to change their
Yeah,
life.
because it's a lot of effort, you know?
It's a lot
Speaking
of
of
effort.
speaking of finances, is this something that is covered by insurance that people could, feel like, "Oh, I can't afford that," or anything like that?
You can, if you have orthodontic coverage through your dental insurance, they will cover removable appliance therapy, which is what tooth pillow is.
Amazing. Okay.
So you can submit that. I will also say though, like the average orthodontic case is like $10,000, and getting your wisdom teeth out is probably, I don't know, another 2 grand.
Mhm.
And if you spend about $2,000, I don't know what tooth pillow is in my office. It's more than if you go through tooth pillow, the
Okay.
company. Um, then you could avoid, you know, right now, what would cost you probably $12,000 to help your
Right.
kid. And and when they're 18 and getting all of that done, it's probably going to be almost 20, So I would say it's worth.
There's a payment plan option, I'm sure,
Yeah.
and things to make it work. But I
Yeah.
think like when you've had chronic illness and issues, I think that
It's worth it.
it's worth it because it's the one thing that money can't buy is a quick, like, it's just
Your
like
health.
if you could just heal yourself, you know what I mean? Like, perfect example, like Steve Jobs, like had all the money in the world and he still had an illness that, I forget what his was, but
I don't know.
it took, I think, cancer or something. I don't remember what it was, but you know what I mean? It's just, so it's like all these little things that you can do to like help heal yourself. Like, why wouldn't you want to do these things to set yourself up for success? Because you're going to spend a lot more money and a lot more time trying to fix it down the road when there's a problem versus doing these things, proactively to prevent it from starting.
Mhm.
Yeah, and having poor sleep and low energy is going to make you less profitable,
Oh my gosh, it's going to affect absolutely everything. Like your mood, your confidence, your ability to just do your daily task. And it's like like you said too, it's like everything is a domino effect from that. Just
Yeah.
poor sleep in general, It's like why do you think in the military when they try to, traumatize somebody, they keep them awake and give them lack of sleep.
See, they did this to
it's
me on The
torture.
Bachelor. So when I was on The Bachelor, and they keep you up until 9:30 the first night, or I guess morning, and so like you literally don't go to sleep until 9:30, and so I feel like that's how they start it. Is like the producers want you exhausted and on edge, and like it kind of just leads to this really
Yeah, because
dramatic,
everybody
fun
makes
TV show.
crazy decisions.
It makes
No one's in their right
Oh
mind.
my
Makes for some good TV. But I was like, the sun is up. Please let me go to bed.
Yeah, I'm not okay on minimal sleep.
That's amazing. Yeah, it's really dangerous. Like truck drivers and pilots are not allowed to
Yes.
have sleep apnea. That's why they're all afraid to get tested because it's really dangerous to be functioning on low sleep.
Mhm.
But this is the one thing that like makes me like sometimes I get sad because I don't have kids yet. And I'm like, oh, I'd love to be a mom. And I've worked so hard. I spent 2 years of my life doing all my fertility things. But um I'm so excited though to like be collecting all of this knowledge that I can like, you know, pay forward to my kids and be like, okay, like let's do these
You can
things to
babysit my kids
set-
anytime you want.
I love them, love them. But you know what I mean? But like setting my kids up for
Yeah.
success, but like starting early. And
You're getting all the tips.
yeah, I feel like I'm taking lots of notes so that way, I'll make sure to fuck them up in their own ways to make them funny and give them a good backstory. But I mean, I think giving them things like this and tools for success is like, I'm very excited about that. And the fact that all of this like education is happening and it is becoming more mainstream so we can kind of combat these things and nip it in the bud early.
And
Yeah.
going into, I know this is kind of also just a side topic, but again, it's like I'm so like passionately curious about this, and you don't really hear or see much of the biological dentistry. It's hard to find, right? They're not all over. And you often have this maybe it's a misconception, maybe it's not, that it's just ridiculously expensive. So I would rather maybe go to a regular dentist or standard dentistry. But can you speak a little bit about biological dentistry and like the things that you do differently in your office?
And
Yeah.
how somebody can find someone like what they need to be searching for to find someone like you. Because not everybody can go to Montana, unfortunately.
Yeah. There's more and more of us that are waking up to doing dentistry this way. I think it's the future of dentistry. Like eventually it won't have a special name. I think it'll just be the way dentistry is done.
I hope so.
But basically it's more of a root cause approach. I would say I do diagnose way less dentistry than I ever have now because I'm like, okay, we got to work on your microbiome. I make no money helping you work on your microbiome. We can do some ozone therapy and get you on probiotics and make sure you're nasal breathing. That is sometimes like you buy mouth tape, you buy probiotics, and you get $60 of ozone with me. And then,
Well, when you say ozone therapy, are you meaning I actually have an ozone machine, but I was like, "Oh crap, I don't have an oxygen tank." So I needed the oxygen tank to do the ozone machine. Are you doing it like intravenously, like through IV? Are you doing it as a mouthwash? How are you doing that?
I do it as an IV with my primary care doc because I believe in ozone that much. It's 8,000 times more powerful than chlorine.
Yeah.
But when I see patients, I do it with gas or water. So we
Oh,
use ozonated water as like a rinse. We
okay.
do when you get your cleaning, the water that's in the machine, that the ultrasonic little tool that cleans your
Mhm.
teeth, that's ozonated water. So it's like gives you kind of a fresh start. But if we really want to sterilize the mouth, which we can't do, but the best tool that we have is ozone gas, which is super
Mm.
powerful. And that free electron just it like gets quickly through the teeth. So the teeth have miles of pores in them. And when we put the ozone gas on there, it'll like disinfect the tooth. So it kind of gives us a fresh start to give us a fresh start with the microbiome and bring in probiotics. And then we have to talk to patients too about your diet. Like
Right.
you have to eat healthy foods because your mouth is the beginning of the gut. And this is all going to
Mhm.
be affected by what you eat, obviously.
Mhm.
But I've seen, like in myself, I had some cavities that I was trying to remineralize for like 20 years. I was watching these interproximal cavities and I was on
Right.
fluoride, actually, like a prescription fluoride forever, and it did nothing. And I
Mhm.
finally did quarterly ozone gas treatments with probiotics and they remineralized because my
That's
body,
That is
they're
crazy.
constantly
amazing.
remineralizing on their own if
So
you give it the tools.
really quick, so for people who have never heard of ozone before, ozone therapy and water and gas and all the things before, can you just give a quick description on for what the benefits of it are and how it works?
Yeah, so ozone is like that really nice smell after a thunderstorm, that like
Okay.
clean smell. It's three molecules of oxygen that have that electricity cause them to come together. And so it's very quick to like dissipate, right? But it can be used as an injection, the gas, or you can just literally put the gas onto the teeth with your ozone machine, or you
Mhm.
can make an ozonated water out of it. So, like, an ozonated water can be really helpful for cleaning your veggies.
Mhm.
Or like, we don't like to use it as a mouthwash because we don't want to constantly kill the microbiome. But if you do like spurts of it, where you do it from time to time and just kind of like clean up the environment, you can use gas and water to accomplish that goal because it's really safe for the body. It doesn't hurt
Mhm.
your body at all, but it will kill bacteria, like I said, 8,000 times more powerfully than chlorine does.
It's like 99% like oxygen, like
Yeah.
pure oxygen. I actually got mine to do ozone enemas. That was like my goal. But
Yeah.
Did you ever do that?
no, I didn't get to do it, but I have the machine still
I
sitting
got
here in a box, never touched. And I'm
You
like,
should do it.
This is
It's
like
like
gold."
Judson Wall, who's the best trainer in biological dentistry in the world. He makes all of his patients buy an ozone machine so they can do ozone enemas at home because he's such a believer in them.
Yes, I know.
I
I have it.
I've heard about this, and I got stuff to do like a coffee enema at one point because I was like, "Oh, this is like on my like holistic health journey." I was like, "We're just clean everything out," and I was too chicken to do it. I was like, "I don't know about," but
Not too chicken. I just need to get the stuff to
You need
do it.
some quiet time when no one's around because it is like you don't want your husband to walk in and be like, "What the heck are you
What are
doing?"
you putting up your butt now? It's crazy because I
but
had a girl, I had somebody in town here. She had a chronic sinus infection that went on for years and she saw like so many different specialists. And somebody said, "You should go to a biological dentist. There's one, 45 minutes away. You should go see her." So she's like, okay, goes and sees her. She gives her an ozone injection in her sinus in right into her sinus cavity, and all this huge, like, years old mucus chunk, this is gross, comes out and clears her entire sinus issue that she's been having like chronically for years, and she hasn't had a sinus infection since. Like, it was a miracle.
Just giant booger stuck up there.
Just, yeah.
Wow.
So I've had a few patients lately that we've been doing expansion with who are like, dude, at one point some mucus came out that was like really old. I don't know how to explain to you how I know that it was old, but it was old. And I think as we're
Do you
expanding,
count how many rings it had?
How many layers?
Just opening the passages, and some like hidden pocket will drain that has been harboring something nasty for a really long time.
It's crazy.
So could you do like a neti pot with like the ozone water? Would that be like a crazy idea? Or
I don't think that would be crazy. Maybe that might be nice, actually.
And during COVID, so a big thing, there was a doctor in France, big into the ozone realm, and he was like curing patients of COVID just by doing ozone IVs. And it was like I was hearing all about it, but no one was speaking about it obviously then. But it's like ozone's been around for a while, and I wish more people would, talk about it and use it. Because you can even spray it on your counters and clean your counters.
No, it's amazing. I was doing a lot of like holistic research. So my stepdad was diagnosed with cancer earlier, or I guess last year now. And at first, like while we're waiting to go to Dana-Farber and like all that stuff, and for him to figure out what's what and what, up is down, I needed somewhere to like put my energy and to be proactive in some way. Cause like there's nothing I can do but at Dana-Farber, but I was looking into all of these holistic things. And, alkaline, the water and the way that affects things, and everything can't live in an acidic environment. And like, I was making him ginger shots and all these healthy things and going all about it. But one of the biggest things I had discovered was about, the ozone water and the ozone little machine. But I couldn't convince anyone to spend the money for it. They were like, that's a load of crap. And I was like, it's not though.
I think an ozone machine is like $1,200 now. I mean, it's a lot of money, but it's not.
Yeah.
I mean, it's not a
if
lot
you can heal yourself from all these different things, like you say, it's worth it,
I was just excited. I got him to put some baking soda in his water to be like, let's try this for way cheaper.
Start here.
I would like make him all these special juices, and I would spend like, hours getting the stuff, juicing it, putting in all these fancy little bottles so he'd have it. And then I would go back to their house and I'd be like, you didn't have any of these things that I did. So he's fine now. So it's all good. Dana-Farber, they handled it all. But I needed to have something to do with all my anxious energy to like feel like I was helping the cause. But I would love to get to the ozone water machine. I think
I think it might have something to do with the reason that anti-parasites are working for so many different kinds of cancers too.
Well, it's funny because you were saying about like the dark circles on the eyes and all that stuff. And there's so much about parasites also. And I feel like between the mouth breathing and then the parasites, I feel like those two are like a huge, and like also there's so much mold like in people's houses that we're unaware of.
The metals we're absorbing.
Right. And it's all these like little things that I think that if we just kind of nipped all of those in the bud, like we'd see drastic health improvements with everybody.
Yeah. I actually think it's one of the reasons people can't lose weight is because the fat is harboring some of the heavy metals. Like that's where
it holds on to all the toxins.
And I think their bodies are like, I don't want to get rid of this fat because it's going to release.
Keep me safe.
That's just my theory. It could be completely wrong, but
no, I've heard that before too. Is that like the fat cells hold on to the toxins, thinking that like they're protecting you. So it's kind of like your body's working. Yeah.
The other thing about sinus infections with biological dentistry is when we take a CT scan, we can look to see if they have an old root canal that's failing, which is really common because root canals only really last 5 to 7 years before they become so infected that they eat away the bone again. And so that can cause a chronic sinus infection just because it's constantly draining like pus and bacteria and nasty stuff into the sinuses.
I have a root canal and I panic about this all the time because I got the root canal before I had taken my, put on my tinfoil hat and learned all about all the holistic health things. And I think about that all the time. I'm like, oh, what is that root canal up to? And then, so I know I'd love for you to elaborate a little bit more on why root canals are a little bit, why more people are not opting to do root canals, but also I would love to get your take on crowns, if those are safe, and if it's the same as a root canal. And I'd love to hear your perspective on that.
Root canals, basically, there's two different ways to get a root canal. One is if the nerve dies from trauma, and then
Mhm.
you don't have any blood flow going through the tooth anymore, and it becomes necrotic because we have to have blood infiltrating everything in the body in order for it to stay healthy. So, and then sometimes it gets infected because bacteria that cause the cavity get it through the pores of the teeth and into the nerve, and then it becomes infected. So, what we do is we open it up where the nerve and the blood supply is in the center of the tooth, and we pull all that out and we clean it, and then we fill it with gutta percha, which is like a rubber, and
Like a
we
fake vein, right? Or like a
yeah,
fake nerve.
it's like a just a way to fill it so you don't have a void in there.
Okay.
And what they do is they put a raincoat over the tooth so it doesn't get all over your mouth, but they soak the tooth in bleach and they pray that the miles of pores of that tooth get disinfected by the bleach. And if you see a really good endodontist, maybe they use some ozone gas. And
Mhm.
so they do everything they can to totally disinfect that before they fill it with rubber. And they debride the walls. So they take out the innermost layer or the innermost layer of the walls of the tooth. So they kind of clean out the most infected tissues. And basically, what the research shows is that every single one of those teeth, even if you pulled it out the next day, still has some bacteria in it.
Mhm.
So over time, with no blood flow in there, you're leaving this dead tissue in your face. It's going to become infected again, unfortunately. And so your choices then are to like redo the root canal, but now you have this brittle dead, it's like a branch that has no fluid going through it. They become more likely to crack and the success rate goes down. So we tell patients it's like a long-term temporary. Like you can do that if you want to keep your tooth, but you got to realize like eventually we're pulling this and doing an implant
Shit.
because
Okay, so I have like, what do I need to do for this root canal I have? Should I have it taken
you need
out
to
and
I
done
had
use
my
over?
first root canal at 7.
That's so
oh,
young.
Yeah.
hopefully that was a baby tooth.
I don't know, but again, my mom was a hygienist, and so they were telling her all these things. So she was giving me massive amounts of fluoride. So
Mhm.
I have like dental trauma. So I'm always like, oh my gosh. But I would love to like get it all done. But I've seen people do that, and they have so many flippers and stuff. And I'm like, I don't want to go that route either.
Yeah, flippers suck. I mean, the thing is like sometimes you have to bite the bullet just because you don't want to be walking around with an infection in your face,
True.
So there are ways to sometimes we can do an implant immediately and get a temporary on it right away. I
So you're
mean,
still doing implants in your office?
yeah, Dr. Chris, who's my associate, does all of the surgery in the office with this biological approach. He's freaking amazing. And he does ceramic implants. So he does these zirconia
Okay.
implants that come from Switzerland. They're the top of the line in biological dentistry. It's like the only brand you should use. It's called
So you're not putting
SES.
the metal in your mouth.
Yeah, and it's all zirconia, so nobody has any allergies or any like battery type symptoms with it, and
Mhm.
the tissue heals really nice up against the zirconia, but they're very technique sensitive, so you can't just get any old dentist to put a zirconia implant in. So that's one of the things that's very specifically biological. Some of the other stuff that we do is like we use uh, a composite restoration material, like a plastic filling material that's mostly ceramic filled. It's BPA free. It comes from Germany, so it reduces your just toxin exposure. But I would say the biggest thing that we do is just looking root cause. Like when somebody comes in and they're like, I get cavities every time I'm here. I'm like, okay, are you mouth breathing?
Mhm.
Every time they're mouth breathing.
It all comes back to the mouth breathing.
Yeah, you need to be looking at the airway. You need to be looking at the breathing habits. You need to be looking at why are they clenching and grinding because of your airway collapse. Like what's causing this tooth to have so much breakdown? What's causing this recession? It's like always comes back to airway.
Right. Well, and it's like people don't realize because of when you're mouth breathing, it's drying up everything in your mouth, which you're losing all that saliva when your saliva is actually the one that's like being the hard working,
Keeping your teeth healthy.
keeping everybody clean and, so it blows my mind that something so small can have such drastic effects.
I think it's like too simple. Like I pictured dentists in the 80s being like, just that was like when we thought baby formula was better than breast milk. It's like we thought,
Mhm.
oh, we got to dive into this. I'm going to create an antibiotic that's a powder form that we can shove into a pocket. When it was like, why is your
Right.
mouth dry? Like
Right.
it's too simple, but it's like saliva keeps the pH neutral, and it has
Mhm.
full of minerals to help remineralize the teeth, which are constantly remineralizing and demineralizing. Like the basic God's plan or the universe's plan for how we are supposed to function in the head and neck gets out of whack. And then everything kind of starts to fall apart. And it really becomes obvious in like 40s and 50s. These patients come in and I'm like, now we've had seen a lot of breakdown, but it's like the pattern goes, and then I'm like, okay, this is why you have high blood pressure. This is why your blood sugar's off. This is why you have metabolic disease. Like we've been now 4 decades of no nitric oxide and high
Right.
pH and all of your heart pounding at night to try and circulate the blood. They compound on each other to become really detrimental to the overall health.
Wow.
Cool.
It's so it's
Nice.
like mind blowing.
Great.
I'm sorry,
Cool.
guys.
Tons
No,
to look forward
It's a
to.
lot. It's a lot to
Digest.
digest. Yeah.
Yeah.
Well,
And it's funny,
you
like,
gals are on the right path.
Yeah. We're
You're
trying.
doing awesome.
hey, it's the right. It's nice that we have access to so much information where we're not just being fed one thing and going, okay, yes, sir, thank you.
Yeah.
And it's like getting this place where we can actually collect different data and think for ourselves and take a little bit of this and a little bit of that and let everyone kind of, hey, if this isn't for you, that's fine. But like, this is what someone else might want to do to help heal their body in a more holistic way and kind of just give ourselves a chance here. Cause uphill battle, it feels like most of the time. It's just like, let's say it's like, oh, cool, great. And they put fluoride in my town's water.
Yeah,
Like it was just
yeah.
like great,
So many
cool,
things.
like all of the things over time. So
Yeah.
Well, I guess like we'll let you go after this. I do have one more question. I guess I always like to hear, and we are the comeback era. I always like to hear like a happy ending story. Is there a story that you could say that's like happened in your care with biological dentistry or airway that is just blew your mind, that you saw someone's life change so
I love this.
drastically?
Great question.
Yeah, we had a young woman who came in who she came with her mom when she first came. And she like basically didn't leave the house. Like she couldn't go to school, she couldn't have a job. She was very grumpy. She was hard to relate to. And we basically got her. She'd already seen like ENTs, she'd had myofunctional therapy, she'd gotten surgery on her nose, she'd done everything and nothing was working. And we did a removable expander for her, the kind that I use on myself, and completely got her structurally like perfect numbers and got her sleeping better. And her whole life transformed. She's got a job. She's got a little Etsy side hustle. She she comes in and like has the best attitude. She wants to. We love her now. Like I take a picture with her when she came in the other day. She's just completely
Changed her life.
Yeah.
full of energy and so cute. And she's losing weight and like everything's kind of coming together really
Falling into
nicely.
place.
Yeah, and her mom was like, "You changed her life. Thank you so much." It's like makes me cry. It's like
Oh, I
Oh,
love that.
really awesome to see that kind of stuff happen. And we have that like honestly, like all the time when the kids come in with their fixed expanders, the parents are like, "I have a totally different kid." It's the most rewarding thing.
As a kid who grew up with ADD, it's so hard when like the teachers don't understand you and your parents there's just this like combative thing going on at all times. And it's like something as simple as your airway. And if like that had some time to adjust or, just trying different things to just make everyone's life just a little bit easier. Like, wouldn't that be nice? So like, what if we all got to lose? I feel like it's absolutely worth a shot.
Right.
So thank you so much for all of the work that you've done with this and the fact that you are able to change people's lives like that is just what a gift and like what a cool purpose for your life. Like I think that that's such a beautiful thing to have such an amazing purpose and to give back to your community and to change so many people's lives. Like,
to have a rewarding job is awesome. Like
so thank you
Well,
so much
for helping spread the word, because the more we awaken people to this, the more lives we can change. So it's really important that we talk about it. And
for sure.
it feels really selfish not to. I mean, the thing is like we're not out here creating this product, but we know about it and it would feel really wrong to not share about it. And so, your purpose in life is to help change people's lives with their airways. And ours is to, use our little soapbox to help spread the word on things that, can make everyone's life a little bit easier. It doesn't have to be this hard. We're all struggling and it's just nice to have a little something that takes the edge
One
off
thing
and
we
makes
can
it
try
easier.
to combat and figure out.
I think
But
it's
tooth
really
filler,
powerful because like people tell me all the time, I know, look at my niece, look at her face. She needs intervention. How do I tell my sister? And their sister doesn't want to hear it, but like she might listen to you guys and be like,
Yeah.
oh, starting to connect the dots. And
Mhm.
so the more that this is talked about and it's educated, the more the moms are going to go to the dentist and say, this is what I want. And the more that happens, the more the dentists will start to learn about it and
Mhm.
come back with their patients to help them. And then maybe we can get rid of this apnea epidemic that we're in, like
Yeah.
where everybody's testing positive for apnea.
And we just really need to remind everybody who's listening that, sometimes your doctor doesn't know what's best and you have to go with your gut and your
Advocate for
intuition
yourself.
and advocate for yourself. Like
Mhm.
I'm the biggest believer in advocating for yourself because like I said, I saw 5 different specialists who told me I would never have my own child. And it finally took me I don't know why I didn't take no for an answer, but I just kept being like that. It just wasn't I was like, that's not possible. Like there's no way. And then I found somebody who, worked her ass off to get me 11 eggs and it took 9 surgeries, but we got there. But it's just funny. Like you have to not take no for an answer and you have to keep advocating for yourself and for your children because there are other solutions. And it really does feel like an uphill battle sometimes. But if your gut is telling you to, look into alternate solutions, there's probably an alternate solution waiting for you.
Mhm.
So
Yeah, I have a lot of regrets about when I didn't advocate. And I don't like if your doctor's pushing back against you advocating, they have some insecurity around that topic. You just need to find someone else. Like
Mhm. Get a
I'm
second
that's
totally
such a
opinion.
fine
good point.
patients
Right.
saying to me, what about this? What if I ask this doctor? What about what she said?
Mhm.
I'm like, let's debate it. Let's dive into it. I always have something to learn. And if they can't look at it that way, I feel like their thinking is just too tunnel visioned and you're not
Yeah.
going to get the results you need.
Not being open-minded enough.
Mhm.
Um, and then lastly, I did want to say Tooth Pillow was very generous to share a code with our listeners that does give them $200 off their treatment and a free consultation. So if anyone is listening and would like to get their child and maybe even as an adult soon evaluated with code LOCHTE, LOCHTE, they are giving you a free consultation with a trained airway dentist and $200 off of your treatment, which is
You really don't have anything to lose
Yeah.
and everything to gain. So
awesome.
Yeah, I mean, when I get consults, like every kid that gets submitted through the state of Montana, I look at their questionnaire and their pictures and I put together a whole treatment plan and it's very comprehensive. And you're going to it'll help you connect the dots. Even if you're like, okay, I don't want to do it, you could get the data and better understanding about what's
True.
going on.
True.
And I think a lot of parents are kind of in that place where they're like, I don't know what's going on. I don't know why they're acting this way or what's, they're looking for answers. And I think this is a great first step to giving them some of the answers for why things might not be going as easily as they, pictured in this like white picket fence version of how you saw things going down with your kids sometimes. So
Never.
Yeah, and sometimes it's more than one thing, but like if they're not sleeping well, you're screwed. You have to attack that. Sleeping and breathing, it's like
kind of the bare minimum basics.
Yeah.
yes, the bare minimum.
Well,
right.
thank you so
Thank
much,
you.
Hilary. It was so nice to meet you.
Nice to
And
meet you
thank
guys
you for
too.
everything you're doing to help everybody because this is just fantastic work. And I'm so excited to be sharing
So
all of
excited.
your work. So hopefully, somebody can feel like a little bit of hope and get some help.
Yeah.
Yeah, well, it's never too late. So don't have that regret. You can always do something about it later on in life.
Love
Good
it.
to know.
All right, well,
Okay.
thank you so much. And
Thank
then
you so
Heather,
much.
also, what is your social media
where can
media
everyone find
handle?
you?
So that way
Well,
everybody
I'm
can
on
find you.
Instagram at Hilary Fritsch, FRITSCHDMD. And I do like a ton of educational content on there just because I think it's like
I love that
thing to wake everybody up.
Yeah, it's very helpful for sure.
Thanks.
All right. Well, thank you so much. We've taken up enough of your time, but
Yes,
thank you so much
being
for
here. Thank you guys. Thank you for coming back to the comeback era, and we will see you next time.
Bye.
Bye.